so June, it's Men's Health Awareness Month. So experts say men, they're more likely to skip out on medical visits. I'm one of them, which is not good, but we're going to listen right now because detection is always the best way to prevent disease.
Dr. Juan Vargas is a family medicine physician with Kaiser Permanente in Panorama City. He's here to talk about how to encourage men to prioritize their health. Good morning, Dr. Vargas. Thank you so much for being with us. And
good morning, guys.
Chris said, he's guilty of this.
I need to go, yeah.
I mean, a lot of us are guilty of putting off these important checkups. Why are men in particular, though, guilty of skipping doctor's visits?
There's a lot of reasons. Men oftentimes will forget that they need to take care of themselves if they're busy, or we have to work, or, there's no appointments when I want it. Some of it is that fear of finding out, what if they find something? Regardless of all that, it's important that we make that effort to come in and get a checkup.
Yeah, such a good reminder because prevention is everything, as we know.
Yeah.
So I got to ask, what are the key checkups that men need to get?
Well, there isn't a one size fits all necessarily. So for most men, it's really get your blood pressure checked, get your cholesterol checked, get screened for diabetes. At certain ages, 45, 50 and older, we start thinking about things like prostate cancer and colon cancer. And all that depends on family history too. So it's really important that regardless of age, you come in and talk with your doctor and get some ideas of where you are and what screening you need.
And as we were saying, so many of us are guilty of putting this off at any time, but especially during the pandemic, a lot of people put off these important checkups. And so what impact has this had on men's health care?
Well, we see a lot of deferred care for things like high blood pressure and diabetes, a lot of deferred screening for things like colon cancer screening and prostate cancer screening. And oftentimes we see the complications of disease that we wouldn't have seen had a lot of these patients been screened. So we're seeing more things like, heart attacks and strokes at a more advanced stage than could have been detected earlier if we had proper screening.
Yeah, no, I agree completely. And, especially the older men, they have a harder time. Like my dad, he passed away from cancer, but if he would have gone to the doctor, maybe it could have been preventative or what have you. So I have to ask, this is for me and for everyone else watching, how can men be more encouraged just to seek this kind of medical treatment?
I'm hopeful that whatever motivation we need as men is that taking care of ourselves because we want to take care of our families, or because we want to be around longer, or because we want to work. Whatever that motivation is, we got to find it and just make that appointment and talk to your doctor. Have your partner, your significant other, your wife make that appointment for you. There's a lot of people that care about you as men. And whatever that motivation is, grab it and try to take care of yourselves just a little bit better.
All right, Dr. Juan Vargas, thank you so much for being with us this morning with some really important information, a great reminder for all of us, men and women alike. So we really appreciate your time.